Hi, I'm David Liew, rheumatologist from Melbourne, Australia, reporting for Room Now from this virtual ACR 2020 here online. It's been a great meeting, lots of great content across the board today. I wanted to tell you about one particular abstract that made one of the plenaries and also was mentioned in the press conference. And it covers a very topical area. It's from investigators from Columbia University, looking at particularly about hydroxychloroquine and QTC prolongation. And this has really been in the media as of late and in the general consciousness. Before this, we obviously as rheumatologists love hydroxychloroquine for our indications with the proven benefit that we know associates with that, the life-saving benefit that occurs in lupus with hydroxychloroquine, and then the really beneficial effect we can see with hydroxychloroquine in addition to things like methotrexate and rheumatoid arthritis. But that's all been thrown in recent times. And I remember first when I heard about hydroxychloroquine and COVID, the discussion that came up from our pharmacists about, well, what have you been doing about the QTC interval and all the discussion that surrounded that. And of course, part of the concern about using hydroxychloroquine in COVID has not just been about cannibalizing the supply for our rheumatic disease patients, but more importantly for the patients who do receive it for COVID, are they potentially at risk of prolonged QTC on their EKGs? And are they potentially, therefore, at risk of tissage de points and sudden cardiac death, which is not ideal, clearly. So the question from that, the risk in COVID comes about, well, are patients at risk? Are rheumatoid arthritis and lupus patients, are they at risk as well? So investigators looked at this, looking at some existing cohorts where EKGs had already been taken. So 307 rheumatoid arthritis patients and 374 lupus patients. And they looked to see what the drivers of that QTC prolongation or QTC length in general were. Now, they excluded patients with existing cardiovascular disease, and I think that's fair because we don't want other things that are going to influence the QTC length. But when they looked at it and they adjusted the QTC for known risk factors of QTC prolongation, they saw that the QTC length between patients treated with hydroxychloroquine versus patients not treated with hydroxychloroquine in that group of patients, there was no difference. So there was no association with hydroxychloroquine and QTC prolongation in general, but really the things that drove it were age, corticosteroid use, smoking, things that we know are linked to QTC prolongation. Now, how can we resolve this with COVID-19? And I think this really speaks to the fact that adverse drug reactions in general are contextual. It really depends on what drug and which disease you're using, what dose you're looking at, and what combinations of medication are in play. And of course, this is exactly what differentiates the COVID use of hydroxychloroquine to its use that we know and love in rheumatoid arthritis and lupus. Fundamentally, in COVID, we're looking at an underlying disease which may well be affecting the heart. We're looking at potentially quite different doses, but more importantly, the combination with other things like azithromycin, which can also lead to QTC prolongation, and you have that combined effect as well. So some reassurance from the data, and when we're in doubt, we should always go to the data, that our use of hydroxychloroquine in rheumatoid arthritis and lupus really isn't something that we need to be worried about or necessarily monitoring EKGs for. It's interesting, I ran a poll today. We've got exactly, in the first couple of hours, we've got exactly 100 votes asking you and your colleagues, when we're prescribing hydroxychloroquine for rheumatoid arthritis, lupus, or other rheumatic diseases, do we routinely order EKG either before or during? And so the choices were 11% said yes, 81% said no, and 8% said, why would I? And I think I can understand how that reflects in practice. So interesting, provoking stuff about QTC and hydroxychloroquine, plenty more about all the topical things that are happening at ACI 2020 on our website, roomnow.com. Come and join us there. Thanks for joining once again, and I'll catch up with you very soon.